Hello, good evening, and thank you for joining us tonight. As promised, this is your show, and we are live tonight. Ask Dr. Saw. We did say that after a few episodes, we're going to be coming live to you so that you can engage with us and you can call us with whatever questions you have for Dr. Saw. And here we are tonight. It's Tuesday, and it's the first Tuesday in October, and we are here as promised. We would like to have a wonderful conversation with you, the public, and as you know, the aim of this show is to get information to you in the best possible way. And the person that you'll be asking is Dr. Saw, and that's the name of the show, Ask Dr. Saw. So Dr. Saw, welcome to the show tonight.
Thank you.
We are live here tonight, and I'm sure you're going to be taking a lot of questions there, and I hope that you can provide answers to the best of your ability. And we're gonna, I think we're onto something very good, because the reviews that I've been getting is that this is a very good show, and a lot of people are looking forward to it. Quite a few people has been sharing it also. So we wanna we wanna create something really, really good here. And just to let you know that myself and Dr. Saw, we are here for the long run. This show is going to be running for a while. I know lots of people has been calling me and are messaging and asking about Dr. Saw and where his clinic is located. Hopefully he can tell you that tonight also, and how he can be contacted. So, Dr. Saw, how has been your week last?
Quite hectic because of the cricket.
Oh, you went to the cricket?
Yeah, of course.
Yeah.
You have after, cricket, parties and stuff like that. But yeah, it was good, exciting.
Brilliant. I had a week away. I went to one of my favorite places. I love New York City. So I spent a week there, came back refreshed, and we're ready to go. So we're going to start off tonight by talking about heart conditions. But first of all, let me say that when you're coming through with your calls, we urge you not, and we're going to be taking calls after the first 15 minutes after we have a conversation, because I see the phone line is ringing already. But let me just say that when you're coming through with your calls, please be responsible with what you're saying. Myself and Dr. Saw and TBN, we urge you not to mention names of people, or like physicians or institutions that you may have had bad experience with, because we don't want to have negative comments on here on the program. But tonight's conversation, we're going to start off with, and as much as we'll be talking about heart, you can call and ask about anything, should I say, under the sun, because you can call and talk anything medical under the sun with Dr. Saw. I'm here to moderate the show, but he's the one who's going to be taking the calls. Dr. Saw, we're talking about heart conditions, and I have a few questions that I would like to start off this program with. We spoke about diabetes for the first two shows, and then we did with hypertension, and now we are going to be talking about heart disease and heart attack, because I know a lot of young people who've had these things. What are some of the symptoms? What are the symptoms related to a heart attack or heart-related disease? How can someone know that they have these things?
All right, as you know, the heart is a big subject. And when we talk about symptoms of heart disease, there are many diseases of the heart. So lots of people would think that, okay, a heart attack is probably the only, or not the only, but just one of the most important condition of the heart. But there are other conditions of the heart that I just want to give some clarity on for us to understand the heart a little bit more. And then I would go on to tell you what are the symptoms.
Yes, I see you brought a model.
Yeah, what are the symptoms of the different conditions of the heart. So let us talk about what a heart is. And I have a model of the heart here. I don't know if we can just bring this up on screen. Now, when we talk about heart disease, there are many conditions, as I say, can affect the heart. So the heart is a pump. It's an organ that pumps blood. And we talk about blood pressure. The heart has to maintain pressure in the vessels so the blood is distributed along the body. And of course, the blood transport oxygen and nutrients to different cells in the body. Now, the heart as a pump itself can give you problems. So this is a pump. So the pump squeezes. Now, if it doesn't squeeze strong enough, you will not get enough blood flowing through the vessels. So you can have something. So if you have a pump failure, we call it heart failure. So I will go on to tell you a little bit about that. So there's a special symptom for heart failure. So when we talk about heart, we are not only talking about heart attack, angina. So we're dividing it up into different sections of the heart. So when you have heart failure, so that is defined as heart failure. So if the pump fails, that is heart failure. And there are lots of conditions to cause that. So what happens if the pump fails? The pump meant to squeeze blood out of the heart. If it doesn't squeeze enough blood out of the heart, the blood builds up and it gets congested into the body. So it gets congested, it can spill to the lung. So you have something called pulmonary congestion. So people would have heard when you go to the doctor, they listen to your lungs and they say you've got fluid in your lungs or you've got water in the lung. What it means, therefore, is that you have congestion in the lung, and one of the causes would be heart failure. So the heart can't expel all the blood, it pools up in the vessel and it spills in the lung. Now, that is one. You also will have pooling of the blood in the veins of the leg. So the cardinal symptoms of heart failure would be swelling of the legs, so the blood pool up and you have swelling of the legs. You have fluid in the lung and you will have shortness of breath and exhaustion. So because the lung has got fluid, there's not enough movement of oxygen in and out of the lung. It impairs oxygenation and you have shortness of breath. So I would say that is for heart failure, the cardinal symptoms of heart failure. Now, what else does the heart have? The heart has got vessel. So when we open the heart, so if we open the heart a little, so you see the muscles of the heart. These are the muscles of the heart, and the heart itself is supplied by its own blood supply. So if you look at a first image, you've seen vessels sitting on the muscles of the heart itself. Now those are when you have a blockage of these vessels, that's what you call a heart attack.
Okay.
So what happens there? If there's a blockage, there's no blood flow into the muscle. So the muscle gets what we call ischemic. That is no blood, no nutrients, no oxygen getting into it. And that's what gives you chest pain. So the initial symptom, we would say, right, you've got angina. If it gets really bad and it shuts the supply totally, you have a heart attack, which is called myocardial infarction. So that is heart attack. Cardinal features would be, of course, chest pain. Now, how do we define a chest pain? You get chest pain for various causes, but when it comes to the heart, when we talk about chest pain that is heart-related, so if you get chest pain, because that's a big symptom, when somebody says, I've got chest pain,
right,
I have to be able to decipher that chest pain to establish where is this pain coming from. So if you look at the chest by itself, they have muscles in the chest wall. So the pain can come from the chest wall. So we'd say, fine, if you touch the muscles and you feel it and it's painful, that may be chest wall pain. Below the chest, the muscle, you have your rib cage. So you can get pain from the rib cage itself. Right. So injury to the ribs, you have cartilage. There's some, that grizzly bit, what is called cartilage.
Yes.
Okay, you can have those inflammation, you get chest pain from that. But usually those symptoms, if you press on the chest wall, you would feel those pains. If you're having a pain from the heart itself, it is unlikely that you will touch here and feel the pain. The pain is in the muscles of the heart, and the heart is protected by a covering called the pericardium. Inside of that is where the muscle is affected and you get a pain. Now, how do you get a pain? If there's less blood flowing to the muscle give you, you get what we call ischemia of the muscle, and that gives you chest pain. So the type of chest pain you will get is chest pain and exhaustion. What I mean exhaustion, if you exercise and the heart rate increases, it needs more blood. So if it needs more blood and there's a blockage, you would have pain. Now, that's a cardinal feature of angina or heart attack if it gets really bad. Now, if we go on to see what else can go wrong with the heart is electrical. It is supplied by electrical circuits. Now, the heart beats, it meant to beat regularly. Lub-dub, that's how we define it. Lub-dub, lub-dub.
Okay.
If you have a heartbeat that is irregular, whatever it is, erratic.
Yes.
Now, that is called an arrhythmia. So it's an electrical malfunction. And so you can have, so when I explain the heart to patients, generally, I would say that there are basically three components or three sections when it comes to how we classify the conditions of the heart. There are other conditions I'll talk to you about briefly, but in general terms, you have a pump problem, so it gets failure. You have a blockage of the vessel, which you have angina and heart attack, and then you have electrical problem where you have irregularity of the beats, or the beats can be less beat. So I said to you in earlier episodes that your heart meant to beat between 60 and 100 beats per minute. If it goes under that, it is abnormal. If it goes over that, it is abnormal. And also if it beats irregularly, erratically,
Right.
then those are abnormal. And usually those are electrical problems. Now that is to answer your question in terms of symptoms. Now there are other conditions in the heart. You have valves, so it allows blood to flow in one direction. So you can have leakage of the valves. So you have valve problems, so that's a different condition. And of course, these conditions can lead to heart failure. It can lead to conduction problems and all of that. So there are different conditions of the heart that can cause different things. You can have an infection of the heart. So there are lots of times patients with viral infection, they have something called myocarditis. The heart muscle is inflamed itself, or the covering of the muscle called pericarditis. You have infection of the heart. During COVID time, we have seen infection of the heart from COVID infection. Wow. So these are conditions you can get. And then you have some endocarditis where the inside of the heart is also infected. So there are lots of other conditions, but I would just define, just tell you a little bit about those.
Time is already running. We just have a few minutes before we start taking calls. But here's what tests can be done to know whether there is an issue, because early detection might be the best thing.
Absolutely. No, yes. So indeed, everyone knows about an EKG or an ECG. In the UK, we say ECG, in America, EKG. So that's where they put electrodes and they check the electrical activity of the heart. When I talked about electrical problem of the heart, that's probably the basis of the test of electrical activity. But it doesn't only tell you electrical activity, because if the muscle is damaged from a bad blood flow to that muscle, the current cannot flow properly in that muscle. So you can see it in the electric circuit.
Right.
So you can look at an ECG or an EKG, and you'll see that there is an irregularity of the beats, and you can say, fine, this can either be an electrical problem, or it could be a problem with the blood supply to the heart that gives electrical malfunction. So that's one, EKG. You can also have a test where we do a scan of the heart. So like how you have an ultrasound of the organs of the body, you can have an ultrasound of the heart, and it's called an echocardiogram. Now, usually we do that to look at the valves, the muscle, how strong it is contracting, and the strength of those contractions. You have other tests where we have angiogram, so that's the gold standard when we're looking for blockages of the blood vessels. And then you have lots of other something called perfusion scan. They give you a dye, then they scan the heart, and they see how the tracer moves into the heart. So there are lots of investigations we can do for the heart itself.
Look, I've got quite a few more questions I want to ask you related to that. But as promised, we have taken up our 15 minutes already.
Oh, goodness.
And this show is about the public. So the lines are open. You have the numbers up there. It's 231-2982-610-1066, or you can get the other number there, which is my number, 652-1314. Start, make your calls, ask doctor your questions, and we have our first caller from the United States calling here. This is someone who we know very well. Let me get this. Good evening, caller. You are live on air.
Good evening. I want to give you a virtual hug because you're giving all the medical advices, and I'm pretty sure you're doing it without financial support. Boss, the world like cash. I tears actually when I'm looking at this program, right? Because of the fact that we have a doctor come and expertise and advice.
Yeah, we're losing you. We're losing you a little. I don't know if it's. I know you're a bit emotional, but we're losing a little bit. But Try to get a better connection, please. I don't want to. Well, we don't want to lose what you're saying, right?
Okay. All right. I think I don't have the right. I don't know what's going on. Anyway,
Okay, go ahead. We're hearing you better now.
Okay. That you could have brought this program to life, and you can get a superb human into this program.
Sir, here.
Vying for this.
Let me call you back right now from this number because I'm not getting a very good connection and you're breaking up. So let me call you back immediately, please.
Thanks.
Oh wow. No.
Hear me better now?
Yes, yes, we are. I hope, hopefully, yes.
Okay, I'll reiterate my sentiments, Dr. SAWH. I want to give you a virtual hug because you have come to this program and you're giving us all the medical advices for free. Right? And the world, if I can reiterate my sentiments, the world needs more human beings like you. And I'm so proud that Akash could bring this program.
Yeah, I know.
Thanks.
Indeed. Thanks for that. And of course, it's a team effort, and I'm grateful for Akash to put me into this direction.
Well, fortunately, I know Akash a little bit, and I think he's a decent human being too.
I would think so too.
Indeed, of course, yeah. Do you have any medical question anything bothering you that you would like?
I actually do. Akash would have know a little bit. I've actually lost a daughter to cancer.
Sorry to hear. Breast
cancer. Yeah. I think complacency might have played a part, but if you can shed some light on what we can do in terms of cancer detection, early detection, and what people can do to help to minimize the deaths, because there's no way you can stop the deaths.
Absolutely. I mean, if you know, when we talk about leading causes of death in the United States, and of course that across the globe generally, we look at heart disease as the leading cause of death in the US, followed by cancer. I always say to people that there are only two things probably going to take us down besides natural disaster and injury would be, gone are the days where we have severe infections, that take us down. However, cancer and heart disease are two common things that we have to be, careful with. Now, when it comes to cancer, the thing about cancer, I would always reiterate to patients, one is important for screening and also for us to identify symptoms early and manage them. Now, thank God for advancement in medical science and technology, we are better able to diagnose cancer. The downside generally that I see that is a cause is delayed diagnosis gives bad outcome. So if you're going to get a cancer and you pick it up early, most cancers are treatable, even curable. So if we have, let's say, a bowel cancer, you resect it early, breast cancer, you resect it early, you can actually cure the cancer. If you don't pick it up early and the cancer goes on and it advances and moves to different parts of the body, then cure is usually, you cannot cure it thereafter. It is all about palliative care and treatment to prolong your life rather than curing the disease. So I cannot reiterate or overemphasize the, how useful screening is. Now, the other thing is, if you have symptoms related to cancer, you might not know any symptom that is there for a prolonged period, whatever it is. So even when I talk about any symptom, I usually start with a head. If somebody get a headache, you ignore headache for too long, it could be cancer related. You have a cough coming down to the chest, you have a lump in your neck, you have a cough, you have fever for prolonged periods, you have a lump in the breast, you have bleeding from the vagina, bleeding from the stool, in your stool. These are all signs and symptoms that you have to look out for, and I think that's where we should have good screening techniques. Unfortunately, not all cancer can be screened.
I am so happy that I am getting this explanation, Doctor and Akash Prasad, because I personally think complacency might have played a part in my daughter's demise. And what Doctor has explained there just now, I hope the world who's looking at this program heed his call, and because every child out there is my child. I do not want another person to die from cancer.
No, indeed. I think we have to send that message across, and there are lots of programs.
I'm urging the public that are looking at this program right now to heed the call.
Correct.
Heed the call of me. Heed the call of Akash Prasad. Do screening. Take care of yourself. Do not be complacent.
No, absolutely. I would just try to go through quickly some of the screening that I mean, either if it's available nationally, whichever part of the world you're in, you ask for it. So when it comes to, let's say, for instance,
Dr. Sir, I'm living in the US. I'm living in the world's best country, and my daughter still could not have been saved.
Yeah, no, indeed, I understand that. Well, sometimes you have what we call occult cancer, where you have cancer and you don't have symptoms. Because by the time you have symptoms, it's sometimes too late. It's spread to different parts of the body. And that is why sometimes that's why I emphasize the point. Screening is important, and we have regular screening. But there are some genetic conditions, and cancer can have genetic predisposition, runs in family. So I would urge everyone who
It does actually. I'm glad that you mentioning this, because all my dad's sisters died of cancer.
Yeah, so when you have families who have got cancer and there's a strong family link, we will take extra precautions. We will try to urge patients to present themselves to the doctor as soon as they have signs or symptoms of cancer. So, yeah, I think that's important.
And I'll reiterate, the public that is looking at this program, please listen to Dr. Sir. Please watch the Akash Prasad show. Heed his advice. We can save lives by listening to medical advice coming from professionals. Once again, guys, Om Shanti, Salaam Alaikum. Take care, guys.
All right. Thank you for coming through. And I hear the emotions in your voice, but we hope that you know your story and our Doc's explanation here and what we are doing here can help save lives. So thank you for coming through. We look forward to hearing from you. You know, I don't know. I don't want to say that we're hearing from you in more medical conditions, but thanks for the support, and you can always call into this program.
Yeah,
thank you very much, guys.
Yes.
All right. Goodbye.
I mean, cancer is a big thing. I mean, it's the second leading cause of death in the U.S.
Yeah.
After heart disease. And lots of these things,
we have another call. Yeah. Good evening, caller. You're live on air.
Yes, I'm calling from Canada.
Right.
I'm a heart patient.
Uh-huh.
December, I had 5 stem put in, and 3 of them was blocked 99%. So I'm one lucky guy right now to be around.
I'm happy that you have been treated and you've had your stents. But of course, again, heart disease is something very, very common. And I would urge patients when we look at heart disease causes, we look at risk factors. And yes, sometimes you cannot predict it, but we have a general way of looking at your risk, and there are some risk calculators that can be used. And before even you have symptoms, doctors will generally want to pick off patients before they have symptoms. So we do risk stratification, and we put you in categories and say, fine, these are high-risk patients, and we start to modify your risk factors or start treating them to decrease your chance of having it. Lots of patients go on to have blockages without knowing, and there is a system where the body has got a type of protective system that lots of people, you go and do an angiogram for them, and they have blockages that they didn't know about. without any symptoms. Or they may have something else giving them symptoms and not their heart itself. Let's say they have chest pain for another cause, but they ended up having an angiogram. You see that they have blockages, but they have what we call collateral flow. So if a vessel is blocked, and over time the body can develop new vessels or augment those vessels that are there to give supply, and it bypasses that, and that's a natural bypass system the body can have. But I mean, tell me, was there anything? I mean, you're doing well now, and I suppose you're on your medication, you're having your regular checks. So I would urge you to take your medication, and whatever risk factors there are, I'm sure your doctor would look into that.
Do you have any questions for Dr. Sardo?
Yes, I'm still getting some of these pain in my chest, and it's like a burning, stinging pain. I get it just under my breast, my left side, and sometimes I get it in the center of my chest.
Right. So when we describe angina type pain, usually it's not burning pain. Generally, usually it's like a pressing pain on the chest, but burning pain. So, no, a couple of questions I would want to ask you there. Do you get a pain randomly, or do you get a pain when you exercise, or if you do exert yourself? How would you describe this pain?
I describe this pain when I'm stressed, and right now I'm going through a lot of stress.
And how long would the pain last for? I mean, is it seconds, minutes, or hours? What would you say?
It lasts for minutes, and it goes away, and then it come back again. Right now, as I'm talking to you, I'm feeling that pain in my chest.
So a couple of... All right. So there are a few things you've said there. So from just taking a little bit of that history, normally if it is coming from the heart, so if you get it randomly at rest, and it is lasting a couple of minutes, let's say less than 5 minutes, and it's not associated with exhaustion, I wouldn't think that's not your typical presentation of angina. Burning sensation also, it could be things like reflux, so acidity can do that. And when you're stressed, when you're stressed, your gastric acids can be more secreted, you have more secretions, and you can cause that burning pain. But anybody with my first job, when patients come to me and present with chest pain, I will say to them, if you have other causes of your chest pain, muscular pain, or due to gastric causes, you're not going to die immediately. And my first and foremost job is to ensure this is not coming from the heart. Mm-hmm. And once I've excluded that, then I can go look for other causes. Then I'll say, fine, what else could it be? Could it be your chest wall causing you problem? Could it be acidity in your stomach causing you problem? Could it be the covering of your lung? You have lots of other bits, in your chest can give you problem. You could also have the nerve that supply the muscles around the chest wall that can give you, we call that neuropathic pain, where it can be burning type of pain in the chest. Now, however, I'm sure as a heart patient with stents, if you have ongoing chest pain, usually your doctor would recommend that you have a perfusion scan. We call a myocardial perfusion scan. So you don't necessarily have to have a new angiogram to check that. They will do a dye, they give you a dye, and it's a tracer dye, so it's got a tracer element in it. And then you inject that into the body, you see how it flows into the heart, and you take photographs, and you can see which part of the heart is affected. So if the blood doesn't get into a section of the heart, you'll see that it's devoid, or there's no flow there. And then we can say categorically that this is due to lack of blood supply to the heart, and it is heart related. I mean, you are in a country that I'm sure that is a procedure they do routinely. So if the doctor has given you that reassurance, and you have talked to your cardiologist, and he said, right, you know what, I have checked you out thoroughly, I know that your perfusion scan, it shows that your heart, the blood is flowing perfectly into the heart, then I wouldn't think that's the cause. I would look for other causes. Lots of time after stenting, patients are on a dual antiplatelet drug, that is blood thinners, and some blood thinners can cause gastritis, inflamed stomach. You meant to take a gastric protective drug as well onto that. So I think you should have that looked into, especially if you're getting those type of morning sensation.
And three weeks ago, I was getting the same pain, and I went to the Emerge.
Yep.
They did all the tests that they could do, and they say everything is fine. When I came home that day after, I started back feeling the same pain. But the pain is not moving around. It's staying one place. I had all of those tests that you talked about done.
Sure.
And they say everything is okay. I had to die twice.
Right, so we are saying conclusively, therefore, that this pain is not coming from your heart. So we have to look at other parts of your body that the pain can be coming from. Now, if they have excluded the heart, then let us look at your stomach. Now, have you had your stomach looked at? I mean, they can put a camera in your stomach. You can do tests to see if there's acidity, extra reflux. Sometimes you put a camera, you don't find anything, but we do pH studies, that is checking the acidity. They put probes into your stomach and they check the acidity. So there are lots of tests can be done, especially in your part of the world. Now, if I have checked everywhere and I can't find a cause, there are times I try neuropathic agents. So there are drugs, especially if you're talking about burning sensation. There are drugs that decrease that sensitivity of the nerve, where we can do a trial of that to see if it will blunt those sensations. So there is some sort of treatment. Maybe you can talk to your doctor if they have excluded everything. You can do a trial of neuropathic agents and see if it makes a difference.
I had that done too. I had the camera into my stomach from my mouth down, and they're claiming that everything is perfect, but I'm still getting these pains.
Well, it's a difficult one. I mean, I wouldn't be able to say conclusively. I mean, I would have to review if I were to, say, all right, I've got a patient like this, I will review all the causes. And also, if you look at, there are some patients who can have different pain syndromes that is ill-defined, or there isn't a specific cause. I always relate pain. How do we experience pain? You have a sensory, something that goes through the nerve, it goes to the brain interprets it and say, right, we've got pain, we've got burning, we've got stabbing, or whatever the type of sensation. Now, there may be a malfunction of that pain circuit. So we have some malfunction of pain modulation, and sometimes it is not so easily, you cannot clinch a diagnosis, and then we would say, fine, let's have a trial of some pain type of option in terms of pain management. And, I would send if I have patients like these, sometimes I refer them to a pain specialist who then can go through after I would have exhausted my options. Mm-hmm. There are people who are specialized in just pain management, and there are tests that they can do to look at the nerve conduction in terms of how pain signals are transmitted and how it is, it goes to the muscles. They do all these specialized testing. So I think those are the kind of conversation you should be having with your doctor.
I have basically everything you talk about done. Yeah. Well, I got a lot of complications. I have diabetes, arthritis, sugar, high blood pressure, cholesterol, everything. Ooh. So I don't know what causes that. Right now, I'm taking 9 pills in the morning and 2 in the evening. I'm on 2 blood thinners.
No, I'm sorry that they can't really pinpoint your exact cause for your pain. But I would also want to emphasize that in patients where we can't find the exact cause of their pain, there is, if I am reassured that there isn't anything else that a doctor possibly can look for, or we can do to make the diagnosis, I normally do remember, as I said, the pain is the brain interprets it, and if you're stressed, stress by itself can manifest in some types of pain syndrome. So there are centers like in the UK, for instance, I have patients with chronic pain syndromes that we send for psychotherapy, and we have seen lots of results where those patients get better, and sometimes that just those reassurances and having some sort of medication or some sort of psychotherapy or pain intervention will help. So I think you can explore all of that.
Well, right now I'm having some headaches, and when this headache comes on me, like I get dizzy.
Right. Now, this headache is something new, or it's been going on for a long time?
It's been going on for a long time. I can't sleep at night. I hate nights. I don't sleep. I do the sleep apnea. I had to get one of them machines, the CPAP machine and everything, and it's still doing the same thing.
Yeah. No, headaches is really a big thing in terms of a big subject. In terms of if we were to cover everything, I would have to go through headaches with you. Now, normally, if you're saying lack of sleep by itself can cause headache. So if you're not sleeping well, it can give rise to headache. But when we talk about headaches that are persistent, that are incrementally getting worse, I would want to exclude the most worrying things. And usually, if we're looking for masses in the brain, for instance, if you have headache that is every day, it's getting worse and progressively worsen, almost all those patients will have to have a brain scan at some point. That is chronic headache.
I did have that done too.
Right.
And they couldn't find, but this is a while ago I had it done, they couldn't find anything. Leave to me to just think if it's all in my mind causing these things.
Well, it seems as if they have done a lot for you already in terms of investigation-wise, and that's why I said having some psychotherapy or just discuss with your doctor. Yes, it can all be due to that, the stress and the fact that you've got multiple conditions, that you're taking lots of medication. They all can give rise to problems, and I think that yes, it would be a good idea to have a little chat to see if a psychotherapy will help you.
Well, I got to go see my family doctor in 2 weeks, and I'm going to see my cardiologist in December.
Sure, yeah.
When I had my first stem put in, the cardiologist told me that I had a heart attack.
Mm-hmm.
All I was feeling was just this pain.
Yeah.
And I was getting dizzy sometime when I sleep. I had jumping and whatnot.
Sure, yeah.
So when they did do it, they put the stem in, and he wanted to know why they didn't investigate to see why I had to get, within a year, I had to get back 5 of them put in.
Sure, yeah.
What I can advise, though, sir, is that after you would have seen your physician, and you said in 2 weeks you're seeing that person, you can call back.
Yeah.
You can call Doc again and give him an update as to what. You can call in on the program. We're here every Tuesday.
Okay, my name is Paul. Like I said, I'm calling from Canada, Toronto.
All right, Paul.
So I will go see my doctor, and if I get a chance, I'll call you guys back and give you an update.
Yes, that's right. Yes. In the meantime, I'm sure Doc would have taken note of all the things that you've said, and we wish you well. We wish you. I would wish you a very, very. I would hope that you can get back to normal and become 100% where you are. And if it's
Right.
and Doc knows this, that I'm one of those persons who believe that the mind can actually help to heal things, because I've used it on myself too. So explore that idea too. But of course, this is a medical condition. I'm just saying that if you think that is one of the things, then you can explore that and how you can better yourself through mindfulness and wellness in from that aspect.
Okay, I take up a lot of your time, but one more question. Sometimes my voice changes. It sounds like if I have a really bad cold, and I don't.
So the first question, how long has this been going on for?
It's been going on for a while, and I've been complaining about it over years, couple of years now, and I've been complaining about it. I had a camera in my throat to see what's going on. They say they can't find nothing,
Of course.
but they could have heard the difference in my voice.
Sure, yeah. Well, I mean, why I ask, your voice can change for transient or conditions that are very mild, just having a cold or just having a viral infection. But if you have conditions where there's a voice change that is going on for months, then I would always get patient to be seen by a specialist to do the camera in their throat to ensure that there is nothing to do with cancer. However, there are some nodules in the vocal cord, so that the vocal cord moves to give you give the voice. And if you have nodules there, you can have a voice change. But if you said you've seen an ENT, I suppose they've reassured you that that's not the cause, and then it could be things like acid reflux can do that as well, nasal congestion.
This voice change come, and I feel like I got something in my throat, but there is nothing there. I don't have a cough. I don't have a cold. I don't have a temperature. Nothing.
Paul, here Paul. Listen. I don't want to do this because we've been over 15 minutes on this one, and I have a lot of other calls coming in, and I don't want to take up the time and not take other calls. But I encourage you to call again and keep us updated. All right, man.
Yeah. One more question. You're located in Guyana or you're in the UK?
At the moment, I'm back in Guyana. I just came back.
I'm coming to Guyana in December.
Good.
Right.
And if you're there, I would like to see you so we could sit down and talk.
Sure, not a problem. Anytime, by all means, you'll get in touch.
Okay.
Yeah.
Cheers.
All right. Good.
Okay,
Have a good evening.
Good show.
Yeah. Thank you so much for coming through.
Thank you very much.
Yeah.
Good.
Yeah. So callers, it's not that we want to, we don't want to cut off the call because it's very important. Health is very important. But again, there are so many calls coming through and we're trying to get that. So we can share this program with your family and friends. Let them know about this program that's here. I have a question here from Ann Harris. She says, "Good night, doc. I need to know what best I can do if I'm pre-diabetes with elevated cholesterol."
All right. So I talked about prevention of heart attack. And when we talk about risk factors, diabetes, pre-diabetes, and high cholesterol, those are risk factors. So we talk high blood pressure, high cholesterol, diabetes, smoking, sedentary lifestyle. Those are all family history of heart disease. So those are important risk factors. So what she needs to do, what's her name?
Ann Harris.
Ann Harris. And what I would say, Ann, we need to get your cholesterol well controlled. We need to get your sugar controlled. You're pre-diabetic, so I suppose most pre-diabetic, if they don't have any other comorbidity, it will be lifestyle modification. That is, increase your physical activity, look at your diet, cut down on alcohol if you do that, and those and the type of food you're eating. So you look at lifestyle modification for pre-diabetic. What I will tend to do with patients with multiple risk factors, we tend to do risk assessment. I talked about that earlier. And the current guidelines will tell us if your risk is if your risk of having a heart attack is greater than 10% in the next 10 years, we will start you on medication.
Okay.
And with your cholesterol, we will go for statins. And of course, pre-diabetic, depending on other risks, we will decide if you can have some sort of diabetic medication like metformin or some other drug. I mean, there are lots of other newer drugs nowadays that would tend to have cardiovascular outcome data. So I think it's all about looking at your risk in general. But I would urge you to discuss with your doctor what is your cardiovascular risk like, and then they will decide on what medication to give you.
All right, great. So we missed a couple of calls. I'll try to call those people back.
Okay.
Yeah. All right, so that call is not. We urge you to call in. We have about 15 minutes more to go on the show. Time is really running up. But
I saw here in the comments people
Yes.
talking about food and those bits. I
Right.
mean, without a doubt, I cannot. I said all the time, our lifestyle is important, and yes, we need to look at our diet, or exercise. There are times lots of people talk here about deficiency, mineral deficiencies. I mean, they're not. I wouldn't say mineral deficiency is usually the cause, but they can all contribute to symptoms that can be related. If you have magnesium deficiency, you can have abnormal sensation in your body. You can have cramps. You can have so. It is important. Now, when we talk about vitamins and the general rule and that. For the most part of it, if we eat healthy and we eat a balanced diet, you really don't need anything unless you have any other condition. But when it comes to certain, vegetarian, we would urge them to have some extra B12. There's certain medication. If you take metformin, it can decrease the absorption of B12 as well. We want to give that. If you have bowel conditions where you have Crohn's, ulcerative colitis, these are conditions, we will then give some vitamin supplements as well. So I think, it is important to be healthy and eat healthy and exercise.
Okay, somebody asks here, Margot Singh says, can you give some info on MDDS syndrome, if time permits?
MDDS syndrome. I don't know, what is that? I would need some.
Yeah. If you can, Margot, if you can give us a little bit more information.
I don't know if they are. Yeah, I just need to know what is MDDS syndrome.
Yeah.
I mean, there are lots of syndrome that have got these acronym and but there's a vestibular type of condition that can cause MDDS, but it's a long, strange name.
Okay.
Where the air condition that can cause that, but I can't say specifically that I am aware. I would look into it, and maybe I can call on the next show. I'll talk about it. But you see, the thing is, lots of times you have medical conditions that are rare, and there is a special department that we have rare conditions.
Right.
That they have all these, because your doctor generally, you will know all the comes. I think there's a call coming in.
Yeah.
So some of the rare conditions, we either would look into it, see a specialist who is involved in that. But I'm sorry, I'll have a look into that.
Good evening, caller. You're live on air.
Yes. Hello?
Yes, we're hearing you, sir. This is welcome to the Ask Dr. Show.
Okay. So I'm happy that you guys actually, you guys have this program on, because I'm not right now, but I would have been, my wife would have gotten the best medical, attention privately or at a private institution, because what is called for a pregnant woman at 14 weeks? What is the protocol for if she's going to have the cerclage surgery? What is it called?
So. All right. Yeah. Okay. I understand what you're saying. So cerclage is generally so this is a gynecologic or an obstetrician specialist area, right? But I mean, as a general physician and a family doctor, I can tell you a little bit. So the cerclage, so the mouth of the womb is called the cervix, and women who have had recurrent miscarriages. Sorry, you're breaking up.
You need to turn the volume down on the because we're getting a feedback here. On the device, please.
Okay, I just did.
Yeah.
Sorry.
So women who have got recurrent miscarriages, sometimes you find that the mouth of the womb is open, sort of, and they cannot keep the pregnancy. So there's a special procedure they do where they tie it. It's a special tie they do on on the cervix, and is a cerclage, we call it, cervical cerclage. And that is usually done by the obstetrician or the gynecologist. Now, in terms of, they will have, of course, they will check for all other causes, and there are special indications when do you do it, but the specialist makes that decision. And closer to the time of delivery, then they would release that cerclage so you can have a normal delivery as need be. But yeah, so I would think that they would, check for some of the common causes of, and once they ensure that this pregnancy, they want to take this pregnancy to term, then they will go ahead and do that.
Okay, great. To disclose the private institution that my wife did her cerclage. So she had two miscarriages. Okay, the third one, she did the transvaginal cerclage.
Sure.
So it didn't go well again. I'm not going to disclose the
Please don't.
The private institution either. I'm not going to disclose that. But so I decided to take the initiative, to seek out, because and I didn't get any satisfaction in Guyana. That's in Georgetown, sorry.
Sure.
So the closest country I came, which was Brazil.
Yeah.
And their protocol here, it's went from Guyana, because she went through we're doing it at a private institution here in Brazil.
Yeah.
And their protocol is way different. And I think whatever protocol they have there in Guyana, it's not working, because on her, it's working. And now she's going to be delivering this month here, because I've been in Brazil for a year now, to go through the pregnancy with her. So when questioned based on what the doctor asked us, their protocol there in Guyana, it's wrong. They're doing it wrong, not according to the books, which is very...
I'm sorry to hear that you had to go through that trouble. I'm happy that, the pregnancy is coming to term and that is going well. But it's difficult because I'm not a gynecologist. For me to know the protocol in detail, I wouldn't be able to. There are lots of times also we have to look at what is available in Guyana, that is. And if there was a technology or a specialist area that is not here, I think, yes, rightly so, patients will be referred to wherever or whatever institution can offer that type of procedure. And I don't think we should be in a situation where we said, okay, this is the only thing available. We should say, right, this is the only thing that is available here that we can do. However, if you go elsewhere, you can have XYZ done. What we should be able to say to patients, frankly, and is for, to explain as a specialist, they would be able to explain what it involves, what is a new technology, what is a new protocol. And sometimes we are a little bit outdated, and we need to, try to be up on speed. And, I think in every specialist area, I'm sure the specialists would be, they will be up, or they ought to be up on speed with all the advancement and ways to do things. And I'm sorry to hear that you have to do that.
Yeah. So what I was, a cervical insufficiency.
Yeah, cervical incompetence. Yeah.
She has that, right?
Yeah, indeed. Yeah.
So no gynecologist, that's not in their field, so we had to seek out a fetal specialist. Yeah. So when I found out, I did my search, there isn't a fetal specialist in Guyana.
Yeah, no, indeed.
A fetal specialist. So it's, so I think,
it's a very highly specialized. I must say to you that, that's a very highly specialized field. A fetal specialist, generally, when we look at before the baby is born, you are their department specially or specialists specially involved in looking at the baby before the baby comes out of the uterus. And yes, we have to understand our limitations locally as well. Our population of, probably close to 1 million people, I would say. We probably would not have specialists in all the fields. And I'm happy that you can find one not so far. I mean, Brazil, I'm sure they've got a massive population, more specialists in different areas. But yeah, no, I take your point, and I agree.
What worries me is, what if there are other persons that suffers from that also? What happens in that case? It's a lot of people in Guyana, also a lot of women who probably have that deficiency also. What happens in that case? Not everyone has that.
Sure, yeah, no, I mean, but what you have done here, and this is the purpose of this program.
Right.
I mean, you have created awareness. And I may not have the answers to all the questions. I mean, I wouldn't say, I would tell people always, the more you do medicine, you get into it, the more you realize you don't know enough.
Yeah.
And however, the fact is we should be clear and open as to the things we know, the things we don't know. We should be able to, as a specialist, when we move on to specialized area, we should be able to offer the best advice. Even though we can't do it, there are things that I can't do, and I'll say to you, hey, I know a guy who can do this, and he is a specialist in this area. I'll make a referral to that. And I think it's all about being transparent. It's all about being frank and open with patients and for them to make those informed choices. I mean, sometimes the practicality is not there for you to go elsewhere, and then you say, fine, I'll settle for what we have. And we do that here. And I think that's the kind of conversation. So you being, you doing this and asking that question, I think that is creating awareness, and people would look into it more, and they would say, fine, there's another option, fetal specialist, we can find somewhere else, things like that. So thank you for that.
Okay. I just want to say the best option would actually, I know it's kind of pushy at the Georgetown Public Hospital, but I think they need a bigger hospital. Public Hospital, because I think they have the best there, because I've had my experience at balancing, and it was really bad. So I'm sorry to say this.
Yeah. We don't look, sir, don't call no institution's name.
No, okay, sir. I forgot.
We just want to say that myself and Dr. Sir are not responsible for that.
But also we don't want to.
You gentlemen are doing a great job. So. Have a great night, okay?
Yeah,
right. Thank you so much for coming through, and
sure.
And thanks for bringing this topic to light.
Yeah, I mean, I just want to highlight sometimes the interpretation of your condition, medical condition, and that's why I like to take time out to explain to patients. So sometimes the information that how it is delivered or how you interpret it may not actually be. It doesn't add up to say that this is the cause of that or that it's a case in isolation, and we have to look at it in totality. But indeed, I think fetal specialist is a very rare, well, even in the best of countries, sometimes you don't get them readily available, and you have to go searching in tertiary centers. And, but it's a good point that, we need.
So we're coming up close to program time, and we want to thank everybody that called in tonight with their for medical advice or questions to Dr. Saw. This show is called Ask Dr. Saw. So and we're going to be here every Tuesday night from 8 to 9. First 15 minutes we're going to be discussing a topic, and 45 minutes of that program time will be going to you, the viewers, so that you can call in and ask Dr. Saw whatever questions you want to ask. Also, I just want to say that that you can, when you watch the show, you can share this with your friends and family, so that they can be part of the show next week, and when we're going to be here again. Dr. Saw, it was, and let me say that I'm looking at the viewers here, and thank you so much for being here with us tonight. We really appreciate your support here, and we would love to. I know Margot had asked about this.
MDDS.
Yes. So we.
I'll look into it. Yeah, I mean, if it is a vestibular condition that he's talking about, so the vestibular has to do with your balance, and when you go into, you feel as if the room is spinning or you're losing balance. So it can be related to that, but I don't know if that is what he's referring to. But I'll have a look if there are other types of condition that is referred to as MDDS.
What do you like to say in closing, Doc?
I think it's interesting, and there are lots of questions patients would have, and our show is new, and I'm sure that as time goes on, we'll bring things to light, and I'll try my best to give explanations in layman's term. I mean, as I say, things that I don't know, and I would say clearly, I don't know. You need to see a specialist in this, or you need to see somebody else in a different field. But the things that I know, I'll try to do justice to it, and I will try to do justice to the program, and that is really to demystify medical conditions, to give clarity to them, to see, what options are there, and once patients and the public is informed about options, and I think that's the importance of this. I mean, that's what I want to really reiterate.
Right. The person that said it's vestibular related.
All right. Okay. So fine. Yeah. So
next week we're going to deal with it. Then,
we have done. I've done a topic on vestibular actually in the past. We can talk about that next time.
All right. So again, thanks for joining us tonight. It was a wonderful first night being live, taking calls with everyone here, and we look forward again to being here with you next week Tuesday. I just want to say before closing that be careful on the roadway, guys. We're having too many accidents here in this little country. Look out for those who are looking out for you, and remember, stay healthy. Have a good night, everybody. All right, Doc.
Thank you so much.
Yeah.
Thanks. Good night.